Okay, thank you. Next up, we have, as long as the technology abides with us, is Cynthia Fisher, who is the founder and chairman of patientrightsadvocate.org. And I see Cynthia, so this is a good sign. And we are going to show your video towards the end of your talk, Cynthia. So thanks so much also for speaking with us today. You are an advocate of some of what we heard Senator Johnson talking about, but really is bipartisan, I believe. So Cynthia, welcome.
Thank you. And I really want to give a major shout out to you, Dr. Daniel Sem, for pulling this Health Economic Summit together at this time in our country of great need for financial certainty for all Americans, and especially the small and medium-sized businesses to start up again in our economy with that financial certainty. So thank you for the opportunity today and Concordia University to be here. And what an honor to follow the speakers and looking at your agenda forward. So I am the founder and chairman of patientrightsadvocate.org. And I founded the organization 3 years ago, having been a life sciences entrepreneur for most of my professional career and a former CEO in the life sciences industry. I've worked across the industry, so unfortunately, I know the good, the bad, and the ugly. And over the past decade, have really seen the greed run amok in the healthcare industry. And you have to say, why is that? And as we look at the industry, a lot of the speakers today have spoken about the brokenness of the system. And at the end of the day, no one was really looking at representing the voice of the American consumer. And who is the American consumer in healthcare? One has to ask. It's not just the patient. Of course it's the patient, American patients. But it also includes hardworking workers, their employers who purchase plans to attract workers to their organizations, and the American taxpayer. And obviously missing in Washington, in the halls of Congress, was the voice of this consumer that had a collective voice to come forward to advocate for change in policy. But lined in the hallways and in the campaigns of campaign finance is the large lobbying organizations that represent the healthcare industrial complex, I believe, Dan, as you say in your book, Purple Solutions. And this healthcare industrial complex includes the lobbying associations, the hospitals, the insurance companies, pharma, and the many, many middle players that are capitalizing on the misfortune of the American patient. And what has run amok is that there's extreme opacity, clouds and clouds and curtains to keep the patient uninformed, and even American businesses uninformed at how they can control their very precious, hard-earned healthcare dollar. So I founded Patient Rights Advocate to bring these stories from around our country of the impact of healthcare on the American patient and American consumers. And these stories were really about patients and businesses and the impact to their financial duress. And in fact, each of us, we all have, or we have been, or we know someone dear and near to us that has been devastated by outrageous medical prices and debt. But we are blindsided to no prices today until well after we've received care. We have absolutely no idea. And even the doctors in the healthcare and hospital systems, some have actually signed gag orders to not reveal prices. And many, over 30 years of care, have told me, Cynthia, I don't even know the price of the methods and the protocols or the drugs or the care that I give my patients. I have no idea. And that is where the problem lies. So I believe there's been a lot of good said today about how do we change the system. And the good news is that we were able to collect through video and through stories and through advocacy campaigns, the voices of those patients like Wanda in Fredericksburg, Virginia, a healthcare worker herself, who was just simply dehydrated and was forced to go by her nursing home that she worked for to the local emergency room. And there all sorts of tests were done looking for stroke. And she was misdiagnosed, mistreated, and mischarged, only to be sued by that very hospital, having her wages garnished. When she makes $14 an hour, to have almost half of your wages garnished, that is a devastating, crippling debt to a single mother with two daughters trying to put food on the table. This has been happening in 20 states throughout our country, where wages are garnished and liens on people's property. And moreover, hardworking Americans that have coverage have faced personal bankruptcy and lost their homes due to outrageously priced medical debt. And there's great price variation in the healthcare system. Dr. Larry Van Horn of Vanderbilt University looked at the claims data historically and found that across our country, that price variation, if you just look at the cash prices in a marketplace, that the cash prices that Dan and the senator were talking about a little bit earlier, those cash prices are typically 39% lower in the same facility than the negotiated rate, the lowest negotiated rate. So when you look at every consumer in this country, should they be able to see prices before we get care, they could choose a cash price, and we could have competition, not only within that same facility using the same providers, to have a cash price versus a negotiated rate that's much, much higher. And you'd have to say, well, why is it? Why should any employer pay a higher negotiated rate versus that cash price? So only in seeing prices can we get to the new models that the question asked, or a little bit earlier. How do we use these health savings accounts? Well, they don't work to give consumers purchasing power when you can't see prices in advance. And guess what? There's tremendous positive momentum for this movement, because not only are many doctors like Dr. Keith Smith, who will follow me on the agenda today, and I believe it was 12 years ago that he launched out to provide one price, one patient, all patients, and post all those prices online. But many, like Texas Free Market Surgical, OSS Surgical in York, Pennsylvania, many have followed suit, and they're saving patients and their employers tens of thousands of dollars for the same procedure. Add that all up, those employers are saving collectively. And we brought those stories. If you go to our website, you can see both the patient stories, but also these new solutions online. We brought these stories forward to the administration, and we brought them to Congress to show how these employers contracting with these surgical centers and direct primary care doctors that David Balat will be talking to you about later, that are posting their prices online. And also, you're seeing big trends in a price transparent model. They're saving 30 to 50% on healthcare. This is great news to put the runaway cost of healthcare and these trends of both care running away with price gouging and overcharging, and sometimes even fraud. But if you can't see the prices beforehand, you have no recourse or way to know what's the baseline, what's your arguable point to say whether something is fair or reasonable or even fraudulent. But when we can see these prices, we know that employers that are contracting right now directly with these price transparent quality physicians and surgeons that even post their outcomes and their infection rate, they're really competing for care, they're benefiting. And this should be available for all Americans. And in fact, Dan, we've talked about this before. The amazing thing is, over the last year, there were 3 separate surveys. One started with the Harvard-Harris poll back in May of 2019. Then the urologist large group practices did another survey, and the McLaughlin group just came out of the field doing yet another. They saw 88, 89, and 91% of all Americans. So let's just make that nearly 90% of all Americans are unified and agree on one point, and that is that they want healthcare price transparency from their providers and from their insurance companies. And what does that do? That is the free market. And where, in this time, in this critical moment, do we have politically that type of bipartisan agreement? We have it from we the people. And so I would say to Senator Johnson and his colleague, Senator Tammy Baldwin, both representing the Democrats and the Republicans here in Wisconsin, I would say it is time to sign on to this very principle that needs to be delivered to the American people. The McLaughlin survey also just came out of the field and saw that nearly 60% of all Americans want healthcare price transparency right now. They don't want a delay. The good news is the Trump administration did invite these innovative surgeons, doctors, and employers that are using the price transparent model, as well as the patients that were devastated, brought them in for many, many listening sessions. And as a result, they put together the healthcare price transparency rules last summer. These rules would make hospitals show their discounted cash prices that we've been talking about this morning, as well as system-wide, all of those negotiated rates with the insurers. And it would apply to insurers too. Why is that important? Well, that empowers the American consumer. That gives us control, both as patients, workers, and employers, to be in control of making our healthcare decisions and shopping for quality and for price. So we know how to shop, and we do it in every other facet of our lives. I mean, really, no one would allow this to happen in buying a car, booking a flight, or going to a grocery store. I mean, can you imagine going into a grocery store and not knowing for your gallon of milk what it was going to cost until a month later, and then seeing it was 10 times more than the $4.50 you expected? But worse than that, could you imagine paying a facilities fee for the honor of walking into the door of the grocery? Well, that happens in healthcare. And could you imagine going to the checkout line and getting into the wrong line because that doctor might have an ologist next to her, that cashier might have an ologist next to her name and end up being an out-of-network cashier? All of this is what we accept and tolerate in healthcare every single day. Yeah. Well, I have to tell you that nearly 90% figure of bipartisan support is an overwhelming ask to our leadership in Washington to deliver healthcare price transparency. And it's critical. It's bipartisan. It's what we the people need. And on top of it, it is an economic stimulus. It will save Americans. It will empower us. And guess what? You know, Dan and I have talked about this before. The Congressional Budget Office scored the Healthcare Price Transparency Act that Senator Braun and Senator Grassley, and now a total of 9 other senators, introduced to the floor of the Senate. And Flores, Congressman Flores, introduced a comparable bill in the House. That bill, if enacted into law, will cost the government absolutely nothing to enable hundreds and hundreds of billions of savings. And as we're approaching $3.7 trillion spent in healthcare, you can imagine that when we empower the consumers to shop, it's transformative, and it's the first giant leap that we need for a free market to take place. Yeah. And the model has been proven. So we're at an overwhelmingly exciting time. And as both sides, this is a purple solution, because both sides are trying to figure out what's the appropriate economic stimulus forward. This is a no-brainer. I mean, every single American understands how to shop. Every single American understands that they have been blind to no prices. They have been blindsided by overwhelming medical bills. And on top of it, they've been expected to pay with a blank check. Right. And this has got to end, because we have to protect our consumers from not only COVID in this crisis, but we have to protect them from financial ruin. Yeah. And I'll give you some data. Some of the data is that 64% of the American public doesn't go to the hospital right now because they're in fear of financial ruin. Not COVID, it's financial ruin.
Right.
The other numbers that are overwhelmingly interesting is that we've learned from the former head of the Office of Management and Budget that 80% of the high deductibles, of the deductibles that the workers have, because let's say about half of healthcare coverage is conducted through the business arena, where people have it through employer plans or Obamacare. 80% of those with non-chronically ill conditions never spend down their deductible. So you can imagine if we fully fund our health savings accounts and we have healthcare price transparency, all of those savings can be compounded every year for those individuals, their families, and it will be a savings legacy for generations to come.
Right.
And then and only then, when we see the cash prices and we see levels of negotiated rates, will we cut out all the middle players that are capitalizing on our misfortune and streamline and get rid of the price gouging outliers and fraud.
Yeah.
And only through transparency can we have accountability in healthcare. And I will tell you, the American public is so appreciative of the hardworking doctors and nurses that are on the front lines every day fighting this COVID pandemic. However, they have lost substantial trust in our healthcare system because there is no accountability today. And consumers are being gamed, and highway robbery is being committed every day. And small and medium-sized businesses have, over the past 10 years, seen annually almost double-digit increases in their coverage for less and less. And when you look at what can be done and put in reverse, this is a huge economic stimulus to our economy that will rapidly put us back on track and can be available to all Americans, which will codify the rules to make hospitals and insurance companies reveal their real prices, empowering all of us as early as January 1st of 2021. Yeah. That is tremendously exciting news. However, we need it passed in the Senate right now in this next stimulus. And it is up to Leader McConnell and Schumer to come together in a purple solution and deliver for all constituents, all Americans, and our businesses, because it is the small and medium-sized businesses, the mom and pops, the American dream that's been most devastated from this pandemic. Wow. So the urgency is now. So on that, I would just like to thank for this opportunity and encourage anyone on today to do a shout out to Senator Johnson and Senator Baldwin. Please sign on to this bill. Please make it happen. And it will be a new day, all right. 2021, awesome. That we can all. And at this point, I'd like to share with you a video that kind of shares some of those stories and how the American voice has helped to affect change.
Thanks, Cynthia. Yeah, we'll queue up the video now. So.
Thank you.
While Sean is doing that, I'll just share a quick anecdote. Oh, there it is. Is everybody saying that? While Sean is working on that. Oh, now it is. Okay, here it comes.
Some are finding the lack of transparency is hitting them right where it hurts the most, their wallets.
All I heard is, I need this surgery, it's pretty much life and death, but he never said $101,000. And he never said, oh, by the way, I don't accept your health care.
With healthcare price transparency, we would instead know those prices up front.
Polls show Americans overwhelmingly support price transparency.
We're in agreement, and it's bipartisan. What other sector of our economy are we blind to know prices before we buy?
Medical professions have to post prices of what the things cost, literally cost, and they have to post measures of quality as well, so that you know what you're buying, how much it costs ahead of time.
We decided we should post all of our prices online. We have changed our pricing on our website 4 times, and in each instance have lowered the prices. We had a patient from Georgia that was quoted $40,000 for a procedure on our website listed at $3,600. The patient used our price to leverage a better deal. They actually matched our price in Georgia.
We launched our membership-based primary care program. We charge a flat monthly fee for unlimited services in our office with no copays, no deductibles, and we do not bill any third-party insurers. We found a very easy way to take routine care and make it affordable for everybody, whether they had insurance, no insurance, good insurance, or bad insurance. They could all be treated the same.
Patients and businesses could save 30 to 50% on health care.
We lowered our cost by 3x, at the same time lowering the team members' costs by over $3,000.
I can look at 4 procedures that saved this company $100,000.
Almost a 50% reduction in the cost per employee per month. So I'm getting better results from the medical side, but I'm also, from a cost containment side, significantly better.
Over the last 10 months, we've saved our taxpayers just over $500,000, which is money that we don't have to go out for a tax increase for.
We were able to integrate with a rural hospital's employee benefits program. And in the first year, the hospital saved $1.2 million in healthcare claims.
We would be able to choose the best quality of provider because prices bring in quality, because competition drives and improves quality while driving down costs.
Patients thinking like consumers is what will actually transform the healthcare system, will drive down costs, and will actually improve health outcomes for everybody.